My guest is Daniel Benning, a functional medicine consultant for Biotics Research, but also a certified clinical nutritionist and good friend. I was excited to do a segment with Daniel about Cardiolipid, a product developed by Mark Houston, and to hear about some pre and post labs. Here's Daniel sharing what his doctors found. Well, welcome, Daniel, and thanks for joining us. It's always a treat to talk with you. And we wanted to talk about Cardiolipid and some of the results that we've been seeing, the feedback we've been getting from other clinicians. And I want to start out by talking about a slide that was on Dr. Mark Houston. He did on a webinar with Biotics, just showing it was a double-blind, placebo-controlled study that he did on some of the results that he saw. And he said what he saw was reduced total cholesterol, which is great, reduced LDL cholesterol, reduce LDL-P, and the P stands for the particle number, which is really important. Reduce apolipoprotein B, it lowers triglycerides, and VLDL increases HDL, increases the HDL particle number, which is a really positive sign. There's no change or increase in coenzyme Q10. I'm sorry, no change or an increase in coenzyme Q10. It reduces high sensitivity C-reactive protein. And it lowers the oxidized LDL, which is really the most potent modifier causing the greatest damage. And in some cases, it will reduce blood pressure. So it's a very interesting product. Dr. Houston has been looking for the last 20 years for a nutraceutical product that would reduce lipids like that. And so it's pretty impressive. And you've got a couple studies that I asked if you could share with us.
Yeah, thanks, Joe, for having me. You know, when you list that all those factors that this product is seen to do, it's a little bit can it really do all that? And then what we're seeing out in the field is absolutely we're having dramatic changes in blood panels. And I wanted to share briefly right up front the dosing per capsule, because people say, "Well, you know, I'm talking about the synergistic effect here as we look at this." And we talk about this because some of my people that I've looked at it say, wow, that's really not overly a therapeutic dose of red yeast rice or berberine, because per capsule, red yeast rice is at 267 milligrams and the phytosterol is at 233 milligrams. And then there's 111 milligrams of garlic and berberine at 56. You know, that looks like, wow, is that enough? And then the delta tocotrienol is at 9 milligrams. But the dosing we're seeing at 2 BID to 3 BID, and sometimes a little more, this becomes a synergistic effect. Let me just share with you a couple patients that we've had come through with their lab work that has been shared with us. Patient 1 was a patient who was a primary care physician and wanted the patient to go on a statin because her cholesterol was 204. Which doesn't seem excessively high, but the patient was told that if you don't go on a statin, I'm going to fire you as a patient. A little surprising to me. So this patient came to one of my doctors in the Valley here and said, what do you have for me? And at that time, this was brand new to us, the Cardiolipid. So the doctor put this patient on 2 capsules twice a day, and the cholesterol shifted from 204 to 180. The LDLs nicely shifted from 145 down to 108. The HDLs went from 32 to 44. That's a really good shift. Triglycerides stayed pretty balanced. Look at hemoglobin A1C, shifted down a little bit. And glucose, kind of the nemesis to all of this, went from 107 down to 87 without any lifestyle change.
Yeah, that's beautiful. That's very impressive to see that.
That is impressive in a 2-month time span without any lifestyle change.
Yeah.
Patient number 2, female patient, functional medicine practice for over 30 years, trying to get her cholesterol down for at least 20 years, tried everything in the literature. Again, I go back to the synergistic effect of these nutrients instead of using one as a standalone. She did 3 TID, so three times a day for 1 month faithfully. Then she admitted to kind of going on and off for the next 2 to 4 weeks, but still had great impressive results from a cholesterol of 241 down to 180. The LDLs went from 128 to 78. So, being faithful for 3 months and then on and off, that's an impressive change, again, for somebody who had done all kinds of modalities. And our last patient, patient number 3, male pharmacist, tried all kinds of supplements, again, in a functional medicine practice for over 30 years, trying to get her cholesterol down as well for the last 20. And if you look at these numbers, this was at 3 BID, so 3 twice a day, cholesterol from a 206 to a 143, LDL from 142 down to 73. Those are impressive numbers again, Joe.
Yeah. I know that this might be, you've probably thought about this, but one of the reasons why, and you and I both have gone to the IAACN for many, many years, and one of our colleagues mentioned that when you have a stubborn cholesterol, think heavy metals. And garlic is one of the best chelating agents. We always forget about that. We like all the high-tech stuff, but garlic is really a natural chelator. And I wonder if some of these people with these 20, 30-year, cholesterol attempts to get stuff down, here again, you come back to your point earlier, the synergistic factor of consistent heavy metal detoxification in this product.
Yeah, I think that's what we're seeing. All these little pieces of this pie with cholesterol because of this combination in this product. The dosing we're seeing that Dr. Houston recommended for a 50% reduction in LDLs, which is an aggressive amount. Somebody must have a really high LDL count. You're looking at 4 capsules in the AM and 5 capsules in the PM. For a 33% reduction, what the literature was looking at was 3 capsules twice a day. And for a 22% reduction, we're looking at 2 capsules twice a day. So you're getting a lot out of this product. At 2 capsules twice a day for a 22% reduction in LDLs is really, really impressive.
It really is. It is. Well, Daniel, thanks again. It's always fun to share stories with you, and we'll look forward to our next meeting.
Thanks, Joe. I appreciate you.
These numbers tell the story and the effectiveness of cardiolipid. You can click to the right for more information. Thanks for watching, and I look forward to being with you again next Tuesday.